I'll be demonstrating the lumbar supine long axis distraction. First of all, I'd come over to the settings. I would put the traction on, say, a 2 or a 3 to begin with. I wouldn't use any flexion because that's going to put them into extension to begin with. Should the patient's comfortability level tolerate any extension, then go from there. I would also do a hold for about 3 seconds at end range, and count would be sort of between 15 to 20 and maybe 3 reps of that. So first of all, what we can do is we'll get the patient to lay on their back. We'll put a bolster underneath their knees for comfortability, and we'll adjust foot piece accordingly to patient's head length. We'll also flex the headpiece up for patient comfortability. That is one way of using the table. The other way would be to use the lumbar belts. So we just put the lumbar belts in through here. So we flex the headpiece down to be able to put the hook underneath. So that locks in there. Get the lumbar piece. So the circle downwards towards the feet. Open up the foot piece, places underneath. And then you open up the belts accordingly, making sure the patient's pelvis is on the pelvic piece for that. And then you can also further put in arm pieces as well to lock in underneath the arms for further traction. So these are the arm pieces. They come in a few different things. So this is the piece that goes into the table. This one sits on top, so we can rotate in and out of the table. Aaron, come on through for me. Now I'm going to get you to lay on your back for me, thanks. I'm going to lift the headpiece up. Now we're not going to lock in the arm pieces yet, so we'll show the first way first with just the bolster underneath the knees. So I'm going to get you to bend your knees up for me. I'm going to place this underneath here. So Aaron, I'm going to get you to shuffle down the table a little bit more for me. Fantastic, like that. Now if the foot piece is in the way like this, you can also slide it out a little bit so the patient can rest their feet on the foot piece here and tighten it back up again. Lovely. So this is the first option of doing it with less force, and then we just hit start. So I'm going to take my flexion away, and then we're just going to do the traction like this. Now, making sure to always check in with your patient for patient tolerance, and if there's any pain or discomfort, you can automatically go straight back to the stop button. You can also give your patient the emergency stop button to hold at any time, should they want to stop the treatment at any time as well. So I'm just going to stop this. I'm going to show you the next way of doing it as well. So we keep the bolster in through here, but what we do is we lock in the pelvic piece with the belt. So I'm just going to get you to lift your arms up a touch. We cinch in the pelvic piece, and then we go up around through here, and then we lock in the thoracic piece to localize more of the lumbar spine, and then we do the traction again, also being mindful for patient tolerance and comfortability levels. The third way of doing this for more traction is you can use the arm pieces, and what we do is we bring them around and underneath. Lovely. So they can go up underneath the armpits, and then they can lock in there as well. In addition to the long axis traction, supine, you can also do lateral flexion in this position as well. So I'll just get the bar, place it in between the feet, undo the lateral flexion, and then gently laterally flex the patient.